Okay, so again, you have a headache and now you're in the clinic and we want to get some treatment in to help decrease some of that pain and some of that headache. We're going to start off by doing a little bit of muscle work. So we're going to work on relaxing some of these tight muscles. And the type of muscle work that we typically do can very easily be referred to as what's called a pin and stretch type of technique. So when we find a muscle that has some tension in it, we will use our palpation skills to assess to where some of that muscle tension is. When we find some of that muscle tension, we will take that muscle and put it into a shortened position. Using our thumb, we're then going to place a little bit of pressure through that shortened muscle. Keeping our thumb pinned against that muscle, we're then going to stretch that muscle and thus performing a pin and stretch. As we perform this, we're taking that muscle in from a shortened position, relaxing it, adding some pressure, and then stretching out that muscle in order to help it relax. As we're doing this, it would be very normal for there to be a little bit of discomfort or tension as we are placing pressure into the areas of the muscle that are a little bit tender. But as we continue to do this over time, that tenderness should decrease as your headache goes away and your pain improves. Another wonderful tool that we can use in order to reduce headaches is something called dermal traction, or commonly known as cupping. What cupping or dermal traction does is really just pull tissues up and away from the skin. Skin and beneath the layers of skin, there are layers of connective tissue that need to be able to slide and glide really well. Those connective tissue layers can't slide and glide on top of each other. That can cause some adhesions and that can disrupt the blood flow of the nerves beneath the skin. And as we know, right again around that C1, C2 area, we have those lesser occipital nerves that exit the spine, going around the outside of our head. And when those nerves get disturbed, it can result in those headaches. So what cupping or DTM can do, it allows again to pull compression up and away from those nerves to decrease those headaches. So we can just take a little silicone cup, placing it right in some areas of tension or where some tenderness to the pinch can be, placing that cup onto the skin, picking it up and just wiggling the cup around like that. Releasing it will again allow to pull away some of the layers of tissue that can be disrupting that nerve. You can also move that cup around, placing it onto the skin, moving the cup up and down along its path in order to help relieve some of that compression from the nerve in order to reduce those headaches. Alrighty, last but not least, we're going to perform some adjustments in order to help reduce these headaches. Again, we know that cervicogenic headaches have a very large joint stiffness component to them. So in order to reduce that stiffness, adjustments are incredible tools to mobilize those joints to decrease your pain and decrease your headaches. There's a lot of great research showing that adjustments have a fantastic outcome in decreasing cervicogenic headaches. So again, with cervicogenic headaches, typically we are looking at the joints at the top of your neck, C1 and C2, that are entrapping that lesser occipital nerve. However, adjusting any joint in the neck that is a little bit stiff is going to be beneficial. And all this includes is taking that joint into a little bit of tension, just seeing what is a little stiff, and a little quick adjustment. That's all it takes.